Get your day started the right way with Good Day Tampa Bay.
Welcome back, 9:20 now, and this morning on our Health Watch, we're learning more about a health issue you might not have heard about, but that is surprisingly common. We're talking about eyelid tumors. They are abnormal growths around the eye, and joining us this morning once again, oculofacial specialist Dr. Rosh. Dr. Rosh, thanks for being with us once again.
Thank you.
So these eyelid tumors can be benign or malignant. Benign is where it's not as harmful. Malignant is the scary kind. How do you tell the difference?
So, there are some things that we look for when patients come in. There are some kind of diagnostic factors that we look for. Is there lash loss? How long has it been there? Is it ulcerated? But, not every single lesion follows a textbook. So a very low threshold when these patients come in to biopsy them, because until we have a tissue diagnosis, we don't always know exactly what we're working with.
So what are some of the symptoms of eyelid tumors that people should be looking out for?
So patients will also often come to me and say, I have this bump, it's been there, it's kind of growing, it's itchy, it kind of bothers me. Sometimes it's getting so big that it bothers them every time they blink. And so those are all important reasons to come in. If something is growing, even in the lash line, it might be something benign, or it may just be a mole that's been there for a really long time, and now it's starting to get a little bit bigger.
In Florida especially, I feel like we talk so much about dermatology and getting your skin screened, but we might not always focus on our eyes. And you were just saying a second ago that people don't always put sunblock there.
Yes, really important. You got to block out those UVA, UVB rays. If you think about it, the eyelids are kind of like a little shelf, and they just sit there and they, attract all this kind of sun damage over years and years and years.
So what is that removal process? Well, before we get there, I want to ask you what happens if it's left untreated? What would the end result be?
So, there are several cancerous lesions that can occur around the eye. Some are more aggressive than others, and if we don't treat them in a timely fashion, sometimes they can spread and go to other organs in the body.
So if you could just give us your process a little bit. You were just telling me there's a sort of a biopsy involved. What does that all look like?
Yeah, so patients usually will come in, I'll take a look at it, take some photos, evaluate it, and then we will schedule a biopsy. And then depending on what the tissue diagnosis comes back as, I'll see those patients at post-op, and if it comes back as something malignant or cancerous, I send it to a Mohs surgeon, and they are specially trained dermatologists who will remove the cancer and have me come back and close the defect or close the hole.
So if anything around here looks off, feels off, call a doctor.
Yes.
Okay, prevention always the best. Thank you, Dr. Rosh, for being with us. And yeah, my takeaway again is that if something feels off, get it checked out, don't wait.